My name is Kristen Damry, and I'm a physical therapist, and I work at St. Mary's Center for Rehab in Enid, Oklahoma. Well, I'm going to go way back. When I was young, I had a friend who got hurt, and in the summertime, I went to physical therapy with her, and that kind of drove me to want to become a physical therapist. So I went to my undergrad at Oklahoma State University, and then I went to grad school at OU Health Sciences Center, and that was a 3-year program to get a master's at the time. Currently, it's a doctorate. Our profession has really done great in progressing our education, and so it's a clinical doctorate when you graduate. I actually specialize in pelvic health, and so I work with a lot of women who have just had babies, and I think my favorite part of that, honestly, is kind of getting to do life with them. You know, they've just had a big life event and trying to restore their bodies back to being able to do, let's say, a workout, or they love running, or just being able to take care of their kids without having any type of symptom or pain. That's my favorite part, and getting to know their families, because often they bring their kids in with them. Now, that's not the same with every avenue of physical therapy, but there are so many areas that you can go into and specialize in, and that's why physical therapy is so cool, because there are many areas to go. You can be in a hospital, you can be in a clinic, you can be an outpatient, you can be in a nursing home. And if you're at one for a while and maybe your desires change, you can always switch to another one. It's wonderful, especially when we have patients come in and say they've been able to do something that they haven't been able to do for a long time, or let's say they were in an accident. It's been a long time since they were able to do whatever activity that they desire. And it really is a profession where you get to help people reach those goals, which is one of the things that's most satisfying about being a physical therapist, is finding what somebody wants to accomplish and being able to kind of hold their hand getting to that end goal, and then obviously them being independent at it in the end. So you have to be a confident person. You're one-on-one often with patients. You have to know what you're doing and the decisions you're making, because they're impacting a human being. Obviously, you need to be compassionate. We're with people a whole lot, and most of the time they've had some sort of physical setback. And when people are at their most, let's say, desperate and vulnerable time, that's when we're there. And so the ability to kind of feel what they're feeling and encourage them through it is definitely something that a physical therapist needs to be able to do. I definitely recommend seeing if you can shadow a physical therapist. Go into a clinic, go into a hospital. There's avenues for that in most places. Shadow them. See that you really actually like what they're doing. And then after that, you need to know when you go into undergrad what studies to do, what courses to take that would make it to where your likelihood of being accepted to physical therapy school is higher. Also, just service hours, being a good human, doing volunteer hours, and those sorts of things look really good when you're applying to a graduate studies program.
My name is Holly. I'm a speech-language pathologist here at St. Mary's Hospital. So what made me want to go into this field is I've had some past family members who have had strokes, have gone into the hospital and have had to have, therapy done on like their language skills, their swallowing skills, and as a young age I found that really fascinating and interesting. So ever since I was young, I knew this is what I wanted to do. I had a passion behind it, wanting to help other people and just seeing the benefit behind it. So I went to school. I had to go and get my bachelor's degree in either communication disorders or in speech language pathology. It just depends what school, what they call it. And then after that, I had to go on and get my master's in speech language pathology. After that, some people do go on to pursue a doctorate, but it's not something that you have to have. That's just more for research, or if you want to be a teacher, leadership roles, things like that. I would say for my field specifically, having like a passion behind like language and science is going to be really beneficial, because that's something that we're dealing with all day long, every day. But really just, having that motivation to want to be around people and communicate with other people. I would say working in a hospital and on a rehab unit in the hospital, it's all about being a team player and having that kind of interdisciplinary team role. It's not just you and that patient, it's kind of the whole team. So, we're working with the physicians, we're working with other therapists like the physical therapists, the occupational therapists, respiratory therapy, dietitians, the nurses. We're constantly all communicating to try and make our treatment and our care for each patient individualized and what's best for them. I love what I do when you get to see the progress that patients make, and you have a person that comes in after a stroke, can't say a word, and they are able to leave and communicate with their loved ones again. Might just be a little bit of communication, but, just to see that is very rewarding. Same thing if you have a patient come in after a stroke and they can't swallow and you have to put them on thickened liquids, and to see them be able to leave the unit on thin liquids and a regular diet consistency again is probably one of the most rewarding things for me. Getting to see the things that are so frustrating when they first come in and see us. They're so frustrated, they're, angry a lot of the times, and to see the progress that they made and they can actually see that, it's just a really good feeling that, we were there to help them in those moments.
My name is Pam Grants. I'm an occupational therapist and I work at St. Mary's Regional Medical Center in Enid, Oklahoma. So an occupational therapist is a therapist that works with people to regain their sense of purpose in their function in life. We use functional, meaningful tasks to help people to regain their prior level of activity or their maximal level of activity in anything that they want to do in self-care, work, leisure, school. So my motivation was the regaining functional tasks to help people live their best life. I was really in awe by a lot of the fine motor skills that occupational therapists do to be able to help people get back to work and to be able to function better. It was actually a movie that prompted me to seek occupational therapy as a field. So in my career, I've kind of drove down a lot of different paths in therapy and had experience in working in the hospital, working in home health. I've tried and worked in schools, and I finally found my niche in therapy that I work a lot with people that have vertigo and vestibular and that are dizzy. And that's been a really satisfying niche for me. I've really loved exploring and going to the new continuing education courses and really learning more myself so I can have all the knowledge that I need to be able to really serve my patients better. And it's been a really enjoyable and interesting journey. So an occupational therapist gives you a lot of freedom to be very creative in the interventions and the treatments that you choose for your patient, because one of the things about occupational therapy is that we want our treatments to be valued by the patient. And so I get to choose an activity that's going to have an end result that I want, but yet that can happen through an activity that's going to be meaningful to that person, and lots of different ways to go about to get to the end goal. And so I think in occupational therapy, that's one of our really fun things that we get to do. We can have a functional task that we're working on, whether that be we're working with fingers and fine motor, so it not be just a specific task. It may be that we're working on sewing, or we're working on something to get somebody back to being able to play the piano. And so there's lots of simulations that we come up with, and just unlimited amount of things that you can do in therapy to get somebody back where they want to be. I have a gentleman I was working with. We were working on balance, and he's a pastor. And so his goal was that he would be able to walk up and down the steps to the altar in front of the church holding items for communion. And so that was something that we worked on a lot. We came up with a tray, something that would very much simulate the weight and the size that he's holding. We, created a couple of steps, and so that was one of the things that we just really worked on that was very similar to what he would be doing, short of going out to the church, to working with him on that. But instead of just working on stepping at a regular stair step or something like that. So a lot of people hear occupational therapy and they say, well, I don't think I really need that. I already have a job. And so the term occupation really means whatever task is a part of your life that creates the meaning in your life. So your occupation as a child is you're going to school. So those occupational tasks of recreation can be that, you like to play ball, you like to play the piano, you like to run, you like to hike. If you're a homemaker, your occupation then is working on being able to do things around the house, to cook, to clean. And so all of those different aspects of somebody's life are what we look at to get them back to being the whole person.